in every way possible for a safer and healthier Africa and world. Thank you so much for having invited us to join this conversation, and I hand over back to you, Madam Moderator.
And thanks to you, ma'am, Dr. Matshidiso. Unfortunately, the Russia minister, the minister from Russia, had a limited time to be with us today. He unfortunately had to dial out, and he does send his apologies. But we'll move on with the program now, and I'd like to call on our next speaker, the Honorable Dr. Michael Sidibe from the African Union Special Envoy for the African Medicines Agency.
Thank you very much, Fefe. Your Excellencies, ladies and gentlemen. Allow me to begin by extending my heartfelt appreciation to South Africa for hosting this 15 BRICS summit and for affording us the opportunity to convene today's vital discussion on a matter of utmost urgency. Pandemic preparedness, prevention, and response for global health security. While I regret not being able to join you in person due to personal reasons, I am with you in spirit, deeply committed to our shared cause. The COVID-19 pandemic has been an unwavering reminder of the profound significance of a pandemic preparedness, prevention, and response on a global scale. It has not only exposed vulnerabilities between the healthcare systems of various nations, but also underscored the critical need for unified efforts in countering infectious disease outbreak. In particular, Africa's response to COVID-19 pandemic has brought to light the fragility of its healthcare infrastructure. Despite carrying 25% of the world's disease burden, our continent paradoxically produces only 3 to 6% of its own medicines. Furthermore, over 99% of vaccines are sourced from external markets. This alarming dependency on imports underscores the necessity for transformative change to ensure the health security of our people. One paramount step in this direction is the establishment of African Medicine Agency. Africa is home to approximately 500 drug manufacturers, but they face significant obstacles, including underinvestment, infrastructure limitation, regulatory hurdles, restricted access to international markets, and donor-driven procurement requirements. Shockingly, only 5 of these 500 manufacturers hold international certification, a situation that cannot be sustained. It is high time that we act to bolster the sustainability of our production capabilities. The African Union has made a resolute commitment to guide Africa towards a self-reliance in the supply of quality-assured medicine and vaccines. This vision was strongly affirmed during the December 2021 meeting on Partnership for African Vaccine Manufacturing in Kigali, Rwanda. In this vein, the Africa Centers for Disease Control has developed a comprehensive strategy and actionable framework for action that aims to boost local vaccine production from a modest 1% to an impressive 60% by 2040. Moreover, as our nations transition from an era marked by a high prevalence of acute communicable diseases to one characterized by the prevalence of non-communicable disease, we must anticipate a growing number of individuals requiring long-term medication for this chronic condition. In this context, the presence of generic drug manufacturers in Africa plays a pivotal role in ensuring the affordability and accessibility of these life-saving medication. As we strive for equitable and accessible health care, we must be vigilant against trade barriers and personal profit motives that could obstruct our path toward cost-effective public health services. Our mission is clear: to provide healthcare that leaves no one behind. Yet, what strikes me most profoundly is the current global landscape characterized by a seismic political shift. We are witnessing the emergence of multiple centers of power, challenging the traditional concentration of authority. This transformative diversification of influence and leadership necessitates a fundamental shift towards a new paradigm of global health governance. In this remarkable context, the BRICS nations are emerging as a catalyst for change, offering fresh perspectives and innovative solutions to today's global challenges. Their voices resonate with remarkable economic, technological, and innovative strengths, all the while remaining deeply connected to the needs and aspirations of the developing world. But it is not just the actors on the global stage that are evolving. The very nature of the game in global health is undergoing a transformation. BRICS is uniquely positioned to reshape the global health agenda by leading in the following crucial areas: innovation, drive innovation in drugs and diagnostics tailored for the developing world, ensuring that our agility in research and development directly benefit our people. Cooperation, share solutions across the global south, and maximize our world-class research and manufacturing infrastructure by fostering improved scientific cooperation and creating avenues for technology transfer, particularly with Africa. Accountability champion a new deal for global health, underpinned by strong national ownership and clear accountability, where each one of us contributes to a healthier world. In closing, the road ahead may not be easy, but every stride we take brings us closer to the realization of our dream to provide our people and the global community with the highest attainable standards of health. Let us enthusiastically dedicate ourselves to the noble task of building a healthcare system that is equitable, affordable, and accessible to all. I hold a profound belief that united and determined, we can shape a world free from shackles of poverty and disease, a world where health is universal, right, and not a privilege. Thank you for your attention.
And thank you, sir, to you too. Moving on to the next speaker, could we kindly make way for His Excellency Ibrahima Cheikh Diong, who is speaking as the United Nations Assistant Secretary General and also the Director General of the Africa Risk Capacity Group. So this podium is yours.
Good morning, everyone. Good morning.
Afternoon.
Just checking whether you're sleeping. So good afternoon. You know, I know if you well enough, when you say 5 minutes, you really means 5 minutes. And given those great speeches, I decided to put my official speech away and make some remarks, mostly to actually challenge the expert we're going to have later on, and particularly the fact that we're being asked to provide some solutions as opposed to actually rehearsing the problems that we all know. I want to make 3 points. Number one, just reflect on the lessons learned from the COVID-19. And then second, suggest a couple of concrete solutions that we could actually think together so we can be part of the solution, as we say at the African Union, African solution to African problems. And last but not least, I want to put one big ideas on the table, particularly with regard to our relations with BRICS, which I hope will be the takeaway from the conversation. On the lessons learned, let me start with the most obvious one. When we talk about the most vulnerable, one of the things we tend to forget is gender in particular. Women happen to be actually the most vulnerable. So whatever solution that we have going forward is extremely critical that we make sure we have gender sensitive actually solutions as opposed to just talking about the most vulnerable, knowing that gender in particular happen to be a concern for all of us. I think 19 is the power of data, an early warning system and diagnostic and actually risk profiling. I am a strong believer for our policymakers to make informed decisions. They do need to have access to reliable data, but more importantly, they need to actually understand the risk we're exposed to as a nation as opposed to making general decisions without the data. I think third, for some of us who follow the health sector in Africa, have realized most of our countries were caught by surprise and not have a contingency planning, a preparedness that allows them to deal with the pandemic and epidemic sort of going forward. It is extremely critical. From the lessons of COVID-19, we have to develop our investment in our health sector so we can be better prepared. Last but not least, we've also seen as a lesson, the lack of coordination within our governments led to not having the appropriate response in most of our countries. So indeed, it is necessary going forward in most of our countries, we actually strengthen our coordination capabilities so we can actually respond adequately. So the question becomes, learning from this lesson, what are some of the solutions we have to think together collectively? I think number one, we need to improve our risk profiling as well as understanding our exposure to actually pandemic. If you look at Africa as a whole, 50% of our exposure to pandemics are predictable. We can anticipate. And that sense of anticipation allows us as a continent to come up with the mitigations so we can save life and livelihood. And that is why I'm extremely delighted with the Africa CDC. We've decided to join forces so we can start actually map out the risk exposure of African countries when it comes to outbreak and epidemic. I think second part of the solution, how do we actually help our member states, African countries, to beef up our contingency planning mechanisms so that going forward within government, when a disaster or epidemic happened, we actually don't struggle as African government to actually respond. And that is why, again, with the African CDC, we are delighted to actually join forces so we can actually be able to provide the capacity building necessary for African government to be prepared to outbreak an epidemic going forward. I think the third part of the solution is innovative financing. We've seen all over Africa when COVID strike, given the challenges within our national budget, most governments actually struggle to find resources to actually respond. Luckily, there's some innovation that we can do in financing. In our particular case, at the African Risk Capacity, we have been working for the past 4 years to leverage the insurance market to provide actually funding, whereby the first response of our governments is actually provided to the insurance market. And that's why I'm delighted to have the Gate Foundation here, with whom we work with to make sure that our response to the insurance market is gender sensitive. So what it does, basically, it allows actually our countries, when there is a disaster, particularly related to actually outbreak and epidemic, your first response is actually fully funded to the insurance market. But we know that the insurance market is not the only solution. That's why we're delighted with the CDC to make sure we can actually develop other innovative financing mechanisms. In this case, contingency funding, so that will complement the insurance market so we can respond. Last two solutions we need to think about, we've seen the power of the private sector during COVID-19. And I think our governments should actually promote public and private partnership, whereby local manufacturing is strengthened across Africa so that the private sector can be part of the solutions. Last but not least, we haven't talked about it. There's an elephant in the room, and that is the world is about to host COP28 in Dubai. There's a huge impact of climate change in the healthcare sector. So therefore, our solutions need to be holistic, not just focus on the healthcare sector, but also looking at climate change. My big idea is the following. I believe between BRICS and the African countries, we can come together, come up with a very ambitious climate and health preparedness and response for Africa, so no one is left behind. And I hope our expert at the end of the conversation will tell us how do we move the big idea forward so that going forward, no one is left behind. So on that note, Fifi, thank you very much, and over to you.
Thanks, Ibrahima. Some wonderful ideas that you did put forward there that I'm sure will get the opportunity to be ventilated further throughout the discussion. I'd like to call our next two speakers to kindly join me on stage. There are seats here that are ready to welcome the next two speakers, specifically beginning with His Excellency Dr. Jean Kaseya. He is the Director General for the Africa Center for Diseases Control. Can we kindly welcome him with a warm applause? As well as the Honorable Dr. Joe Phaahla, who is the Minister of Health for the Republic of South Africa. Oh, he's a disruptor. And on that note, Dr. Jean, I hope you're not too comfortable, sir, because I'm handing over the podium to you for your presentation. Thank you.
Good morning, colleagues. I wanted to say, as others said, all protocol observed, but I say no. I will not say it for two reasons. The first one, we are in South Africa. And 2 weeks ago, I was meeting President Ramaphosa. His Excellency dedicated 2 hours to me to discuss the pandemic preparedness and response in Africa. And we made a suggestion to His Excellency. We said, you did great job as COVID champion. Why not you can lead the pandemic preparedness, prevention, and response in Africa? I was so happy to hear that, supported by my brother, Minister Phaahla, by my sister, Professor Olive Shisana, where is Dr. Loise, and others. His Excellency said, I agree. I agree to be your champion for the PPPR. 2 days ago, I was talking with him. He said, I want to join this meeting, but I don't know what to do because I have other head of state here. But I'm sure my minister will be there. I said, okay, your minister will take the credit of your job, President. This is why, Excellency, I have to recognize you, and you have to take the credit, but it's not for you, it's for the President. The second one I want to recognize, my triple boss. People, they know why I call this person the triple boss. My sister, Dr. Leah, the Minister of Ethiopia. I don't know if all of you know Dr. Leah. Dr. Leah, they want to know you. They want to applaud you. She's my triple boss because first, she's hosting Africa CDC. Our HQ is in Addis Ababa. Second, because she's member of the governing board of Africa CDC. Third, because the Prime Minister of Ethiopia is one of the head of states and government sitting in the what we call the High Council of Africa CDC. You know that we have 10 head of state giving us strategic guidance, and the Prime Minister is one of them. But we are also recognizing Ethiopia because I'm the happiest man today. All of us, we know now what we knew, a few of us knew some days ago, that Ethiopia is officially a member of the BRICS. I don't know if it will still be BRICS, but it's... By recognizing these two excellencies, I have also to recognize all of you colleagues who are here doing great job, private sector, and all of you attending this important session because we are discussing the pandemic preparedness, prevention, and response for health security in Africa and how Africa can contribute in the world. It's really a great pleasure for me, an honor to be addressing you on the pandemic preparedness, prevention, and response for health security on the sidelines of the BRICS meeting in South Africa. Africa's aspiration for all of its citizens to be healthy and well-nourished by 2063, this is the AU agenda, shall be tested by gains made in the spheres of global health security and diplomacy. Lessons that we learned from COVID-19 pandemic, such as the multi-sectoral collaboration to address the health inequity, shall be essential to defining the nature of long-term collaboration and investment in health systems to make them resilient and cost-effective. We have today the private sector coming together, telling us we need to work with the public sector and our communities through a number of civil society organizations, some of them represented here, to support the agenda of health in Africa. It is essential for us to send another message to all of them, especially to the private sector. What is this message? Health is no longer a liability. Health becomes an asset. Investing in the health area will bring not only the health security for our population, but also will create jobs, economic growth, business development, peace and security, and social development. Excellencies, honorables, ladies and gentlemen, the COVID-19 pandemic is one of the several concurrent outbreaks that we had to fight against the 3 last years. The disruptions caused by the COVID-19 pushed an estimated 55 million Africans into extreme poverty, reversing more than 2 decades of progress in poverty reduction on the continent. During the pandemic, Africa faced different stages and different challenges, including access to emergency response tools and resources. But the pandemic was not only a challenge, but also an opportunity. The opportunity to have cutting-edge technologies and innovation to support our ambition. In response to the challenges and pressures, Africa CDC launched different initiatives and programs to help the continent to respond to the pandemic, including creation of the pool procurement mechanism for medical supplies, the African Vaccine Acquisition Task Team, AVAT, and the Saving Lives and Livelihood program with MasterCard Foundation. This mechanism help us to not only to respond by creating alternative market solutions to secure over 400 million doses of vaccine, but also to open our eyes toward building a more sustainable and lasting programs which will make the continent to be resilient to such shocks in the future. Excellencies, dear colleagues, we have seen the COVID pandemic, but yet another one is coming. Another pandemic is very soon. My brother Stavros said, we have the NCD. We are led by data. We know that another pandemic is coming. This pandemic will be a zoonotic one. It means from animal to human, and will be worsened by the climate change. Because we know that, we need to be prepared. Africa is currently reporting over 100 human outbreaks every year. To make it clear, it means over 2 human outbreaks per week. This will likely increase, driven by population growth, climate change, cross-border movement, urbanization, different types of conflict, and other interrelated factors. This one will not only have consequences on the health sector, but it will be far beyond the health sector. Today, Africa CDC managed to finalize the new strategic plan 2023-2027 to operationalize our long-term strategy called New Public Health Order, which shall address the core public health capacities for stronger and resilient health system, including strengthening the health workforce, the national public health institutions, and local manufacturing of diagnostics, therapeutics, and vaccines. As said by some colleagues, like Dr. Sidibe, we are just using 1% of vaccines we are manufacturing in Africa. We need to have more than that. It doesn't mean that when we are talking about 1% of vaccine, my voice must be doubled. Africa CDC also managed to create 2 financial vehicles that are African Epidemic Fund by transforming the COVID-19 Response Fund, and the second one is the Financial Sustainability Plan. These 2 vehicles will help us to fulfill on more flexible way our mandate to safeguard the health and security of 1.4 billion Africans and contribute to the global health security. There are some of our deliberate actions to better prepare the next pandemic. For this, we think that one of the strong lessons that we learned from COVID is no country alone, no region alone, no continent alone can be safe and healthy if others are not. This calls for stronger strategic and respectful partnership with appropriate collaboration, coordination, and communication. The BRICS nations, colleagues, the BRICS nations and Africa, we have in total around 4.8 billion people. That represent almost 60% of the global population in the world. It is therefore timely for us to be well prepared, and this PPPR side event, we will take it as an opportunity to discuss about our collective future. If we don't do it right now, the whole of the world will remain vulnerable. If we don't set our collective agenda well, we'll remain victims of such pandemics and epidemics. Why we can't, colleagues? I was discussing that with Madame Dilma Rousseff 2 days ago. Why we can't put in place the BRICS PPPR fund? We have the new development bank led by Dilma Rousseff with $100 billion. And I was engaging her why we cannot put in place this BRICS PPPR fund. Let me tell you, and this is the good news, She's so sensitive on that. She's so open on that. And even we have a meeting coming. Together with my brother, His Excellency Ibrahim Sheikh Dion, leading Africa Risk Capacity, we signed yesterday a letter of intent, and we agreed with other AU organs to develop a strong proposal that will foster our strategic dialogue with the new development bank for these BRICS PPPR funds. Excellencies, dear colleagues, it is my hope that the outcomes of our discussions today will provide the needed platform upon which we discuss detailed elements of the partnership and collaboration mechanism and the framework from AU member states and the BRICS nations. As events of public health importance continue to threaten the health and safety of our people, we must remain committed in our resolve to strengthen our emergency preparedness and response landscape. I urge all of our African Union member states, BRICS nations, and our estimate partners to foster collaboration across research and development, workforce development, digital transformation, local manufacturing, appropriate funding, information and knowledge sharing. It is equally important to anchor this to the global discussion and negotiation in the spirit of serving and protecting significant proportion of the world's population. It is my hope that the discussions today will provide practical steps for establishing coordination mechanisms, clear and sustainable roadmap to successful collaboration frameworks. I would like to believe that the conversation and this decision in this room today will birth practical steps that we all can take to high-level ministerial meeting that we are scheduling in the incoming Conference on Public Health in Africa, CPHI, in November in Zambia. Together with my brother, Dr. Pala, representing the government of South Africa, with my colleagues from BRICS Business Council and Africa Health Business, we commit to continue to support implementation of the deliberation of today and to make sure that Africa will be well prepared for the next pandemic. Thank you very much.
Thank you, sir. The minister from Russia has been able to rework his diary, and he is rejoining us right now. Minister, sir, it is over to you.
Distinguished Chair, dear colleagues, let me speak on behalf of the State Secretary, Deputy Minister Alex Alagai. Because of some urgent issues, he has left the meeting. It is my pleasure to participate today in this dialogue on prevention, preparedness, response, and recovery issues. First of all, let me express our gratitude to the government of South Africa for organizing today's event and very productive BRICS presidency. The COVID-19 pandemic has shown that every challenge is full not only with dangers, but also with opportunities. One should underscore that the backbone of pandemic preparedness is vaccines. It was in the BRICS space that the first vaccines against COVID-19 were developed and tested. COVID-19 has shown us the relevance of developing not just vaccines, but new vaccine platforms. Changing pathogens in the near future may force us to release more and more vaccines in a short time. The Russian Federation has developed the well-known Sputnik vaccine and the subsequent Sputnik Light vaccine, which today has been adapted for use in children and adolescents. In addition to them, another vaccine has been developed on a fundamentally different technological platform of virus-like particles from current strain of COVID-19. On the same platform, a vaccine against a rotavirus infection was created, the clinical trial of which began this year. I would like to note as well the vaccine for revaccination of adolescents and adults against tuberculosis. The vaccine is now in the final stage of clinical trials, which should be completed within 2 years. In our portfolio, there are 2 more vaccines against Ebola fever and yellow fever vaccine, and vaccines for prevention of Lassa fever. The latter is undergoing clinical trials. Dear colleagues, the second most important block is the systemization of measures to increase readiness. The pandemic required all countries to take decisions and actions at fundamentally different speeds than before. It required introduction of a completely new approach, management based on operational data. The Russian government has developed and successfully implemented a mechanism for accelerated access to the market of medical products for the diagnostic, treatment, and prevention of a new coronavirus infection. Another key element of the response was the creation of a system for analyzing and monitoring the most important performance indicators of health systems based on primary data. Today, the single digital platform covers not only coronavirus patients, but also those who have been vaccinated. This service includes federal, regional, private medical institutions. All this work is carried by exhaustively in digital format without paper documentation, and all the research results immediately fall into the electronic database. The Federal Register of Medical Organizations and the Federal Register of Medical Workers were also created in the Russian Federation. As a response to pandemic, we are developing several initiatives in the BRICS space. Regarding development of the joint research potential of the BRICS countries to improve preparedness and response to emergencies, we support the need for future activates on the BRICS Center of Research and Development of Vaccines, launched in March 2022. The work of the BRICS Vaccine Center should shape a signal vaccine space of our states. This will allow us to respond quickly to biological threats and ensure the protection of the populations. We also consider it important to activate as soon as possible the integrated early warning system, joint initiative in the field of prevention and control of mass infection diseases, proposed by Russia in 2020 and supported by all BRICS countries. A comprehensive early warning system should include 3 elements: prevention, early detection, and response. I'm confident that these initiatives will help to increase the readiness of BRICS countries in terms of responding to emergencies in the health sector. I thank you for your attention.
And thank you for delivering that message on behalf of the Deputy Minister, Oleg Salagay. Thank you, sir. And now for our last speaker for this segment, we will be now addressed by the Honourable Minister of Health of South Africa, Dr. Joe Phaahla. Thank you.
Thank you very much, Program Director. I can see that you're really in trouble with your time, so I hope that I will not complicate it further. Just greetings to the organizers led by my good friend Stavros and the team from the BRICS Business Council. Greetings to my fellow ministers. Welcome, my colleague, Minister Leah Tadesse from Ethiopia, and welcome to the BRICS family. and also to other ministers present from other countries who have been participating in the BRICS summit, our colleagues, my good friend and brother, the brand new, I'm not sure whether still brand new, a few months, DG for Africa CDC, Dr. Kasia, and also our sister, Dr. who, as she said, will be with her from Monday, this coming Monday, for the Africa WHO committee, and all other distinguished guests, ladies and gentlemen. We really appreciate this opportunity for us to express our gratitude on behalf of the Ministry of Health and our government for the organization of this gathering for this morning and this afternoon by the BRICS Business Council and other stakeholders who have been involved in creating this platform to discuss pandemic preparedness, prevention, and response. This kind of platform is critical for our countries to review our response and, more importantly, to identify robust, sustainable, and scalable interventions to prevent, prepare, and respond to the next health emergencies, threats to global health security, and other disasters. The COVID-19 pandemic, we can accept that it really caught all of us unprepared. As a result, we lost millions and millions of lives, devastating all sectors of our societies, with our health systems hardly coping, both across developed and developing countries. Even within countries, some people even called it, a pandemic which was an equalizer, because while other diseases would be largely deal more harshly with more disadvantaged communities, COVID was non-discriminatory. But of course, we acknowledge the fact that those who are disadvantaged were even more hard hit. It destabilized social and community systems and precipitated the worst global crisis, the impact of which is still with us and will carry on for quite some time to come. Over the last 2 years, as the pandemic raged, nothing was left unscathed. Countries, including ourselves, have been on the journey now to recovery, and we continue to face economic constraints, which are making implementation of economic recovery very difficult. We're trying to address a myriad of challenges across all sectors, and which affect largely, especially those already disadvantaged. But as already other colleagues have mentioned, despite all this, we must also accept the fact that we did learn some good lessons, which were triggered by this pandemic. We all looked at the prowess of our researchers, the community of researchers, and even the speed with which vaccines were developed. And of course, some used this prowess and these capabilities to put question marks as to whether indeed this were experimental or real, but we know that these vaccines have saved many, many lives. New innovative therapeutics also were brought onto the line, new drugs which helped to minimize the impact of this pandemic. On the other hand, we're still also confronted with inequity and unequal society, sometimes even where there were pronouncements of solidarity, equity, and collaboration, it remained lip service, and we have to push hard to make sure, and the Africa CDC and also the AU, the WHO, all put pressure to make sure that this equity and partnership can be realized. So the vision is not to be, for us, from the Global South, it's not, we're not pushing just to be beneficiaries forever, but we want to build capacities and make sure that as we prepare for future challenges, we can be self-sufficient. As part of our recently held BRICS Health Ministers meeting, which concluded on the 4th of August, we did indicate our readiness to institute an integrated early warning system to prevent mass infectious disease and reduce the risks. This is aimed at providing early warning systems and effective response measures to prevent any possible local and cross-border spread of infectious disease and also minimize the occurrence of pandemics. This was a principled decision of supporting countries' existing systems while also enhancing collaboration and to facilitate sharing of information and expertise. In this meeting also, in our declaration, we highlighted the commitment for an integrated disease surveillance and response, and also that we must establish the public health emergency operation centers, which we must share together and make sure that all this expertise, we can be able to work together. This will provide opportunity to share expertise, lessons, building, and evaluating and utilizing the information from all these emergency centers. Furthermore, as already mentioned by a colleague who was representing the Russian Federation, we also continued and committed to the BRICS Virtual Vaccine Research and Development Center. In addition, we must also recognize the excellent scientific potential existing in our countries, and we should utilize it to contribute to the advancement of medical science, improve public health, and foster scientific cooperation amongst the BRICS countries. And thanks for the decision of our head of state to also enlarge the family. So, but also as already led by our heads of state, we're also looking beyond just the family of BRICS, but to all nations of the South. Also in the area of manufacturing, we made that commitment. As a country, of course, we remain grateful to the support of the WHO, identifying us as a messenger RNA hub, and we committed to make sure that we share this with all the other nations. Through our local research institutions, such as in our case, the South African Medical Research Council and our partners in the Department of Science and Innovation, working with the private sector and across other research institutions, we also want to make sure that we embark on the comprehensive and coordinated health strengthening system to improve our infrastructure and equipment, and also improve our ability to procure and supply and produce all these various important therapeutics and other commodities which are needed to deal and be ready. From our side, as the Department of Health, as I already mentioned, we are very grateful for the partnership with the WHO, and early this year, starting with early last year, the DG of WHO visited our center in Cape Town at the AfriGem and also looked at what has already been the progress in that regard, and BioVac as a partner in that regard, and the DG was very impressed with the progress. And he came back in May this year and was again very impressed, and we hope that this will move with speed. But we also acknowledge the fact that while we are moving forward in manufacturing various pharmaceutical products, the reality is that the large majority of the active pharmaceutical ingredients still have to be imported. And we want to commit also to make sure that as we improve our capacity, we must also be able to manufacture the active pharmaceutical ingredients. As BRICS members and expanded, and also as the African continent, we need to solidify our efforts to promote the use of digital technologies, digital health technologies across our systems, so that we can strengthen our information systems so that our pandemic preparedness can be backed up by very solid information systems, because without any data, we will not be able to manage. At country level, we also are committed to make sure that all our countries will be able to strengthen our digital health systems. And in this Health Ministers of BRICS, which was held on the 4th of August, we also made a very strong commitment in this regard. As I conclude, Program Director, as BRICS member states and also as members of the developing countries, we reaffirm our commitment to implement global, regional, and national actions to strengthen our pandemic prevention, preparedness, and response, and also fully address the direct and indirect consequences of current and future pandemics. We want to stand together in this regards, strengthen our cooperation and coordination. I also want to just highlight the fact that over the last few weeks and days, there has been again a reminder that we are not yet out of the woods. As many of you would be aware, there's been various moments of scare where there's been reports about new variants. But thanks to our scientists and also sharing the information, across the globe under the leadership of the World Health Organization. Just last week, we were at the G20 Health Ministers meeting in Gujarat in India, and Dr. Tedros was able to assure us that thus far, the variants which have been identified have not shown to be highly transmissible or causing any severe disease. And as a result, they're still classifying them as variants which are still under investigation, not yet variants of concern. And we want to, it doesn't mean that therefore we need to be complacent. It's just a reminder that indeed, when we say that we are in the era of pandemics, it really means so, because these mutations are still happening. But I think working together, and that's why this kind of gathering is very important. So I wish all of us the best in these deliberations, and I'm sure there will be very productive outcomes in this meeting. Thank you very much, Program Director.
And thank you so much, Minister, for trying to do your best to save my troubled situation right now in terms of time. So we're going into the next section, and just highlighting what the Minister did say, I am in very big trouble in terms of my timekeeping. So I would ask the next session of speakers to assist me in not entering a line that right now is at record levels in South Africa. For our friends who are joining us from other countries, unemployment is at a record in this country. And so to the next speakers, could you kindly ensure that I don't have to join that queue? But as was made mention, there was a lot that was happening behind the scenes when the COVID-19 pandemic broke. A lot happening behind the scenes to ensure that everyone got a fair chance to get vaccinated. And as news reporters and journalists, we all heard of the phrase, the catchphrase during that time that was spoken from the leaders of most people, or most leaders in the world rather, that no one will be left behind. Well, it was a motto that quickly turned into something else in reality in terms of on your own. But that, of course, also led to more work being done behind the scenes to ensure that in future, should the pandemic or another pandemic of that scale or even worse happen, we have got a different framework to hopefully go by to ensure that no one is actually left behind in practice, is actually practiced. And so I'd like to call on our first speaker who will update us more on that process and speak specifically to the process known as the Johannesburg process right now. That is Professor Olive Shisane. She is the special advisor to the President of the Republic of South Africa and co-chair of the Johannesburg process, and she'll be speaking on the progress of the Johannesburg process. Ma'am, thanks so much for your time. It's over to you.
Thank you very much, honorable ministers who are here, Minister Phahla, Dr. Leah Tadesse, Dr. Bharati Pravin Bawa. I also want to acknowledge the Director General of Africa CDC, Dr. Kaseya, and all BRICS members, whether they are new or they are old, welcome you to the family. and welcome you to South Africa also. And all the esteemed members that are going to be speaking here, we really appreciate your being here. And ladies and gentlemen, on the first slide, which I guess I have, okay, on the first slide, what we're trying to do here is just to look at the major infectious threats in the 21st century, as well as the associated collaborative mechanisms that were set up. And this slide coming from WHO shows that we are now experiencing more infectious disease threats than ever before. We have SARS, MERS, Zika, cholera, yellow fever, Ebola, plague, and Mpox. And this occurred, from 2020, up to now. So things are really, really serious. Not from 2020, from 2000 to now. Things are very, very serious. Of late, we do have H1N1 and COVID-19, and many of these threats are still continuing even today. They may continue as epidemics rather than as pandemics, but H1N1 and COVID-19 continue as pandemics. Now, throughout this whole period, we've had many collaborative mechanisms that were used to deal with the challenges that we have. And many of them had challenges with regard to ensuring equity in access, to resources to be able to deal effectively with those pandemics. I'm going to talk about some of them as I go through my presentation. On the next slide, what you see is really efforts that have been set up to deal with the COVID-19 response at a global level, and then later I'll come on at the Africa level. At a global level, we had Norway and South Africa leading the Act A Facilitation Council. And that Facilitation Council was a mechanism that would assist in terms of accelerating the development, of production of equitable access to COVID-19 tests, treatments, as well as vaccines. It really did quite a lot of good, but there were also many other challenges. It was able to raise $24 billion in order to make sure that those countries that actually needed resources were able to get them. Unfortunately, it did not reach as far as it should have. Mechanisms were quite difficult to implement what we needed to implement. So we also are aware of the fact that there are other mechanisms that have been set up past that, and that is the Johannesburg process. That Johannesburg process, as you can see, has got a number of countries that participated in the Johannesburg meeting. There were about 34 countries representing the AU, representing EU, G7, G20, United States, Act A Independent Collaborative Reference Group of countries, as well as the AU COVID-19 Commission and the World Health Organization. All of those comprise what's called the Johannesburg process. Another mechanism that has been set up is the Pandemic Fund, which I'm sure the World Bank will be able to speak to that at a later time. And then at the same time, at a global level, there are discussions that are going on with regard to the INB process. And many countries are actually making input. African health ministers have come together and agreed on what their position should be with regard to the INB. And hopefully they'll be able to their views are going to be integrated into the proposal. Of course, there's still also the international health regulations that is continuing at the moment to being negotiated. On the next slide, what we are seeing is what Africa has been doing with regard to the question of the AU COVID-19 response strategy. Initially, the strategy had quite a number of activities that were taking place, and those activities had to be adapted. For example, we used to have the Africa Task Force for Coronavirus, the Partnership to Accelerate COVID-19 Testing, and the African Pathogenetic Genomic Initiative, and Africa Against COVID-19, Saving Lives, Economies, Livelihood, and Tested and Travel. But that has changed now. We had to adapt it with the times. When President Ramaphosa was appointed AU COVID-19 Commissioner, he went further to adapt the work that he had done before and now is charged with the responsibility of setting up an AU epidemic fund. So he's going to be leading that. But he also was able to establish the Africa Medicine Supply Platform and the Africa Vaccine Acquisition Task Teams. Now, the Partnership for Africa Vaccine Manufacturing was set up under the 2021 AU chairperson, that is President Secuity. And the AU has now appointed President Ramaphosa further for another 2 years to be able to carry out that responsibility. And of course, that responsibility will change to pandemic preparedness, as you heard earlier from the Director General of Africa CDC. Now, there are lessons that we have learned from COVID-19, and I'm not going to go further on this because many of you have heard about the good things that have been done, but also the bad things that have been done. So there is a real need now for us to come up with a better approach to deal with the challenges with respect to medical countermeasures. So when we did the Act A independent evaluation as a co-chair with Dr. John Ann, who's going to come immediately after me, we decided that we wanted to evaluate to see whether Act A did well or not. And when we identified those problems, we found that there is a need really to set up a permanent medical countermeasures platform. It won't be set up now, but it will be set up and finalized when the INB discussions have actually taken place and have concluded. But at the moment, the most important thing is that we need an interim medical countermeasure platform so that in the event we have a pandemic that a surge in terms of whether the existing one or the new one, we really must be able to deal with it, effectively. So we started to have this particular Johannesburg process to try to do quite a lot of things. First of all, we wanted to co-host it. And when we co-hosted this particular facilitation council and included many other countries that needed to participate, we felt that there was a need to really foster deliberations. In other words, have a forum where people can be able to articulate their thoughts, their views. We are not a decision-making body, but we are a body that is really responsible for getting people to speak frankly about anything under the Chatham House rules, to make sure that people can make input without having to be labeled to have said they said this or they said that. It was more important to make sure that they are able to contribute and complement to the ongoing processes that are taking place at the INB as well as international health relations. So far, the Johannesburg process has had a number of meetings. We have had a 2-day meeting in Johannesburg on the 23rd and 24th, right here, and we included many countries, regional bodies, global health organizations, CSOs, and academic and private sector, as well as others. And you'll see that it doesn't just focus on member countries, but it really broadens the space, for communication. We then had another meeting in Geneva in May on the 25th this year, and again brought in quite a number of organizations, countries, regional bodies, and global health organizations. We furthermore had a meeting recently, which included on the 28th of June, which included countries, regional bodies, and global health organizations. And then, of course, we have other virtual meetings that were held, like with this civil society organizations on the 14th of August. And then furthermore, on the same day, we had another meeting with the private sector. And in all these meetings, we invited the World Health Organization to become part and parcel of what it is that we are doing, because they're in the process of developing the concept node that they are consulting with many other countries. We will be having another meeting on the 29th of August. And in that particular meeting, we'll be joined by countries, regional bodies, global health organization, CSOs, private sector, and many others, that are interested in participating. Now, after such a discussion that we had, we felt that we should really try to summarize what people basically are saying. What people are saying as we meet with them, they say there is an urgent need to build on existing capabilities and to be ready for the next pandemic. We needed to build it now. In other words, start working towards setting up a process for a medical countermeasure platform, so that if the pandemic were to strike now, while the INB negotiations are going on, we should not be left being at high risk because of the fact that we repeat the same mistakes that we had before. Now, the key features of the medical countermeasures multi-stakeholder coordination mechanism that has been identified is that we need to have a more rapid and equitable and sustainable access based on the public health needs and also the risk, particularly those that are in the low and middle income countries, which were the ones that were most affected with in the previous pandemic. Now, building on and supporting existing new actors and networks, it's necessary that we must make sure they add value to the MCM ecosystem. We must involve agencies, global and regional organizations, government, civil society, and private sector. But WHO must be at the center of coordinating all of these activities. So some people think that we are going to be discussing things that are supposed to be in the INB. We are saying no, we will not discuss anything that is supposed to be negotiated in the INB, because it will mean that we'll be jumping the gun, and we don't want to do that. But we do need a platform that can be adjusted and adapted as determined, by the INB. I'm going to skip the next slide because it really talks about why there is a need for an interim mechanism, because it has already been said that we have just too many deaths that have occurred. We've lost too much financial resources. The economy has been hit very hard. Education has been really compromised because some of the students were not able to continue to go to school, and the climate change has also suffered. Climate change investment has also suffered because of all of these problems related to COVID-19. Now, WHO is already working on operationalizing an interim coordination. And I'm gonna just talk about the words, or read the words of Dr. Tedros at the G20 when we were and other processes, including the G20 and the Johannesburg process. WHO has developed a concept note for an interim mechanism to coordinate timely and equitable access to medical countermeasures for epidemic and pandemic threats. I seek your commitment to inclusive and consultative dialogue with all member states on the interim mechanism for medical countermeasures. Therefore, this particular meeting is very critical because it is bringing in the BRICS countries to come in and also contribute. And the G20 members themselves had a declaration, and that declaration say that they do support a WHO-led inclusive consultative process for the development of an interim medical countermeasure coordinating mechanism, and which would be inclusive, should have an inclusive decision-making arrangement, including effective representation of low and middle income countries as well as other developing countries. And of course, it should be coherent with the work that is taking place at the INB as well as international health regulations. So what I would like to suggest as I come closer to ending my presentation, because I know the chair is now standing here, what I would like to suggest is that there should be a collaborative AU BRICS strategy, so that they propose their position on medical countermeasures for regions as well as the world, with suggesting that they should focus on services, in other ways, vaccines, diagnostics, health systems, and other measures. And of course, they should deal with the issues of governance, which we've avoided dealing with, financing, research and development, manufacturing, and of course, ensuring a very important point with regard to the question of equity. So the value of the Johannesburg process is laid out, and you can be able to look at it there, but just to say that it is an informal process. It's not a formal process. It allows people to share their ideas. It brings people from the high-income countries, the middle-income countries, and the low-income countries. Not enough. A lot of work still needs to be done. It uses a multi-stakeholder approach. at endeavors to bring the global and the north and south, together, and is partnership, driven. Just to remind you, if you are interested to join the meeting on the 29th, let us know. It's open to everyone who's really interested in participating in this process. Thank you so much.
I'm sorry. And so just next up, very briefly, to comment further on the Johannesburg process, we will be addressed by John Arne Rottingen. He's joining us online, Norwegian's overall healthcare ambassador, as well as the co-chair of the process. John, it's over to you, sir.
Thank you very much. Your Excellencies, ladies and gentlemen, and thanks a lot to Olive. I will just reinforce a couple of the messages that my sister Olive has delivered now. It's a clear message that we need an interim coordination mechanism now, and we should use the political momentum of high-level convenings like the G20, like this BRICS summit, and now the upcoming high-level meeting on pandemic preparedness and response at the UN General Assembly. But saying that we need interim arrangement does not mean that we do not need permanent arrangements. And we are very supportive of the need for continuing discussions as a part of the INB negotiations, as well as the working group on IHR negotiations at the WHO to agree a pandemic accord. Because it's a false dichotomy, it's not an either or, we need both. We need to continue the difficult political level discussions on access and benefit sharing, on intellectual property, on technology transfer, trade, pricing, to, in the long run, really ensure equity. But we also need to establish an interim coordination mechanism that can really build on our collective experiences from the pandemic, including the ACT Accelerator. However, we need to correct the major gaps in those arrangements, and I will mention just three. The first is effective involvement of low and middle income countries in oversight and in giving directions of the work. We tried, but we were not successful of a fully inclusive oversight and governance in ACT-A, and we need to correct that. Second, we need to a full and effective inclusion of regional organizations and entities like Africa CDC and others in operational work of the partnership or the network of networks. And third, we need to ensure an end-to-end perspective from R&D and innovation to delivery via manufacturing, regulation, and procurement, the topic of many of the discussions today. But that end-to-end approach does not mean that some innovate or sell and that others buy or receive. We need a perspective where all regions have capacities to have important roles in all phases of this value chain. And that speaks to the need to foster regional and local manufacturing. So I would highlight that as the third point. So this means that an interim mechanism needs to progress from the models we built on during the COVID-19 pandemic, but at the same time leave the political discussions to the formal intergovernmental negotiations at the World Health Organization. We are committed in the Johannesburg process, South Africa and Norway, to convene further discussions, but really to help and facilitate that we can establish an interim mechanism and that can be marked at the upcoming UN General Assembly. Thanks a lot for your attention.
And thanks for yours, John, greatly appreciated. At this stage, I would like to invite the Minister as well as His Excellency to rejoin the audience in their seats as we do make way for the next segment of the session. Thank you. And that next session really on building on the comments that have been shared already amongst you as colleagues. And it is around anticipating the next pandemic. And so I'd like to invite the speakers who are here as well as the speakers who are joining us online. Well, more specifically, the speakers who are here to join me on stage for that discussion. And of course, we'll be tuned into those who are online, beginning with the Honorable Minister Dr. Leah Tadessa, who is the Minister of Health for the Federal Democratic Republic of Ethiopia. Thank you, ma'am. We also have, to my understanding, the Honorable Dr. Amer Kandil, Assistant Minister of Health and Population for Prevention Medicine at the Arab Republic of Egypt, with us online, as well as Dr. Daniel Roberto Caradi de Freitas, the General Coordination and Substitute of the Director of the Department of Public Health Emergencies of the Secretariat for Health and Environmental Surveillance from Brazil, joining us online. All right, he is there. And last but not least, the Honorable Minister, Dr. Bharati Pravin Pawar, the Union Minister of the State for Health and Family Welfare for the Government of India. So, Minister, I'm going to rejoin you on stage just to make sure that I keep you a bit of company. And of course, we do have our guests online. But we've heard a lot being shared with us already. A lot of the speakers have expressed their views and shared their ideas and raised their opinions around what needs to be done should the next pandemic hit us. We heard that we could very much already be in the next pandemic, as our first speaker, Stavros, did make mention. But ma'am, I was hoping that you could just reflect on the lessons from Ethiopia. And more specifically, in reflecting on those lessons, I was hoping that you could also just tell us how you think the BRICS can further capacitate the pandemic preparedness and prevention and response strategy to add to health security, and also the degree to which you feel some of the targets by the AU, as it does pertain to the manufacturing targets of vaccines, are realized.
Thank you very much for the opportunity. These are a lot of questions, but I'll try to go through it.
Sure.
But before that, I would like to recognize this esteemed panel and the organizers for really this great session, and also for the kind welcome of Honorable Minister Pala and my brother Dr. Kasea for the Ethiopia's joining the BRICS family, which we are very delighted about, which is an opportunity for a bigger partnership. So much has been said this morning and afternoon on what we have learned, but I'll just highlight some critical points that we have learned as a country, but also in our global and continental collaborations through the last very challenging few years with the pandemic. But not only a pandemic, of course, many of our countries have been struggling with so many challenges affecting the public health of our communities, including climate change related to droughts, floods, and conflicts, which all impact the health of the health system and our communities' health. And I think from the pandemic, a lot of lessons have been learned, which were highlighted in this session. One of the critical things that was a strength also in terms of really how we approach the response as a country, but also a challenge that we need to continue to build on is the coordinated response. And the coordination, we have been highlighting on these sessions, the global level coordinations, which maybe I will also mention a bit later. But the country level coordination, a whole of government approach was a key fundamental pillar for a strong response that we've had as a country. But when we're talking about a whole of government approach and the coordination, it was multi-layered. We have the coordination led by the Prime Minister, which includes the members of cabinet established as a committee to lead the response, but also the multi-sectoral coordination, where we have the Disaster Risk Management Commission coordinating the support, and then the health-specific task force led by the Ministry of Health, but also on the other layer of the sub-regional coordination, because we cannot coordinate such response at a national level only. It has to be very well aligned at the subnational level. So this level of coordination was a critical pillar, but just like what we've said for the global level, what we are looking at as we move forward, it also cannot be an ad hoc type. It needs to be institutionalized as we move forward. How do you have such system that can be quickly activated whenever there are such challenge? So from the learnings of the interim assessment we did in our pandemic response, we are working to have that kind of institutionalized system, particularly within the health sector, but also the multi-sectoral one, which requires some legislations. It cannot just happen with having simple committees established, but it has to be backed by strong legislations that can ensure the accountability and responsibility of the different diverse sectors who have to be also take their responsibility in the health security response, from building resilience up to the detection and response, but also building institutions, particularly National Public Health Institute, to take that role and establish that capacity is one focus that we are working on up to the subnational level. The other key pillar that I always like to mention is the primary healthcare system, which where we have seen in the pandemic, the investments we've made, what they could do, what they have helped us, but also we have seen the gaps in our systems that where we need to invest on. So as a country, we've been investing on our primary healthcare system for many years, and more than almost 2 decades, which has contributed to our good response. This is a system where we have health very close to the community to give basic services. So even in our surveillance, the house-to-house surveillance incorporated in not just for the pandemic response, but also for the continuity of essential services, which is one of the key challenges when you face such pandemics, the disruption of essential services, which can even cause more mortality than the pandemic itself. So the strong primary healthcare system really had paid off because we quickly, of course, we had disruptions in the essential services, but quickly recovered to give those basic services by engaging communities. But we have also seen the gaps. Our primary healthcare system was more catered, designed to cater for infectious diseases, but mostly maternal and child nutrition problems, but not for really for epidemics. So investing on making our primary healthcare systems epidemic ready, from the detection to the response, is, I think, one key pillar as we move forward, because I'm trying to mention both the learnings, but also how we should move forward in terms of the challenge. So investing on that, I think going forward, primary healthcare system is still a key pillar as we move forward.
I appreciate that that's a very difficult thing for you to do, to try and bundle all of that, especially within the short constraints of time that we have. But I'm just going to kindly ask you just to pause there, ma'am, and then we're just going to get the further views of the speakers, and in the event that we do have time, perhaps some closing remarks. But to Dr. Amma, so if I do come to you, and perhaps if you can just pick up where Minister Teresa did leave us, we are essentially drawing and reflecting on the lessons that have been learned. But a point that, in fact, the Minister has just made is that it's more important to talk about how we're going to do things in the future going forward. So perhaps if you can just pick up on there as you do reflect on the situation in Egypt moving forward. How should we be doing things? And perhaps even speaking to a point that was raised on stage, the AU's very ambitious target to increase the level of vaccine manufacturing on the continent right now. How realizable do you think it is, and what needs to be done to ensure that it is achieved by 2040?
Good afternoon to you all, Your Excellency, Minister, ladies and gentlemen, Dr. John Kaseya, Director General of African CDC. Egypt, we boast a wealth of experience in preparedness and response planning for health emergency. It be epidemic, pandemic, natural disaster, or any other health crisis. We have consistently updated our plan and the strategy to align with international recommendations and standard. The existing planning has played role in establishing a robust, resilient, and adaptable public health system in Egypt. This, in turn, has facilitated an effective response to the COVID-19 pandemic, ensuring the continuity of essential service and the gradual return to normal life. Our solid efforts have resulted in significant advancement in national capacities. We have bolstered our human workforce by establishing the National Program of Rapid Response Team. Additionally, we have expanded network of COVID-19 PCR testing laboratory to cover all governorates all over the Egypt, with establishment of 55 decentralized subnational laboratories. Moreover, we have successfully localized the production of COVID-19 vaccines, medication, and wide range of medical device and supplies. Furthermore, we have implemented an outdoor COVID-19 vaccination campaigns to enhance vaccine accessibility for all segments of the community. When we examine not only the situation in Egypt, I'm talking about all African continent, numerous major public health emergencies occur each year in Africa. Only in the last 10 years, the continent has been suffering epidemic of Ebola virus, Lassa fever, dengue, malaria, cholera, and yellow fever. Unfortunately, we face challenge in accessing crucial vaccines, diagnostic, pharmaceutical, and would badly affect the continent health economy. The current global health architecture and the governance system for pandemic prevention, preparedness, and response are inadequate in addressing the underlying structure and systematic challenge faced by Africa. The COVID-19 pandemic has exposed the disparity in access to adequate financing, medical supplies, diagnostic kits, and vaccines, highlight the existing gap in the global health architectures and the governance of pandemic prevention, preparedness, and response. This gap has long been pressing issue that require equitable access to provide the African country with fair and timely access to life-saving. If we have back for 14 years ago, when the H1N1 in 2009 hits the world at that time, and after that in 2010, there is a IHR review committee for formulating the IHR at that time, and after that from 2020 until 2040, there is 2020 until 2014, there is a BEEP framework, pandemic influenza preparedness framework. The goal of this framework and this at that times was for benefit sharing and virus sharing. When we're talking, I think in Egypt, it is very important. It is not only for Egypt as I'm talking, it is for all African continent, is local manufacturing for the vaccine. We need the support from all nations, from African Union, from all organizations to support the country in Africa for local production and technology transfer. I'm not talking only about the vaccine, I'm talking about the vaccine, I'm talking about the diagnostic, I'm talking about the therapeutics. The country itself, when we work itself, it is not easy for technology transfer and the local productions. We need from all the coordinations and the collaboration between all organizations and all nations to support and to push the manufacture and the facility to invest in Africa, for local production. This is very important. I hope from all of this, I hope from all of this collaboration and the coordination and the strong movement and the strong support from all levels by the end to succeed by building the local manufacture for vaccine and diagnostic and therapeutic in Africa.
All right.
Thank you.
Thank you. Thanks for your contribution, Dr. Amar. We'll now hear from Dr. Bharti Pravin Power, the Honorable Minister from the State of Health and Family Welfare at the Government of India. Minister, thanks also so much for your time. Your respective colleagues have been reflecting on their experience from COVID-19, but they've emphasized the importance of the conversation around what we do in future going forward in anticipating the next pandemic. So, ma'am, I'll hand it over to you for your input.
Thank you so much. Thank you, moderator. I would like to extend my sincere gratitude to South Africa and African Union for hosting the Pandemic Prevention, Preparedness, Response and Recovery for Health Security Leadership Dialogue. This dialogue provides us with the invaluable opportunity to come together and collaborate on the pressing health challenges we face as BRICS nations and African Union. The commendable effort by South Africa to enhance collaboration in these domains is praiseworthy, as it will raise readiness for forthcoming health emergencies. This partnership shall play a crucial role in formulating impactful strategies to manage the transnational propagation of infections while mitigating their effects on the socio-economic landscapes of BRICS nations. The declaration signed during the health ministers' meeting under South African presidency held on 4th August 2023 in Durban, South Africa, also included elements laying in support of an action-oriented approach in the area of pandemic prevention, preparedness, response, and recovery, instituting the BRICS Integrated Early Warning System for preventing mass infectious diseases risk with the aim of providing early warning and effective response measures to a possible cross-border spread of infectious diseases and to minimize their impact on BRICS countries' social and economic conditions in accordance with International Health Regulations 2005 and in alignment with WHO's Global Outbreak Alert and Response Network for identifying the upcoming pandemics and forecasting future outbreaks through institutional collaboration. I would also like to highlight that South Africa's presidency under BRICS initiative is in harmony with India's G20 priorities, encompassing aspects such as the handling of healthcare emergencies, strategies for enhancement of medical countermeasures, while particularly emphasizing the advancement of digital health innovations. India, under the Honorable PM Shri Narendra Modi ji, dynamic leadership is committed to bring about convergence and coordinated efforts to prevent, detect, remain prepared against, and respond to public health emergencies having pandemic potential, and has been a strong advocate for strengthening various core capacities like collaborative surveillance based on One Health approach, enhancing diagnostic capacities, building resilient and responsive health systems, ensuring safe, affordable, and equitable access to medical countermeasures. Dear friends, India reaffirms the importance of strengthening of national health systems by putting people at the center of preparedness and equip them to respond effectively. This would facilitate achieving universal health coverage with the aim to strengthen primary health care and improve essential health services and health systems to better plan pre-pandemic levels and the health-related targets of the 2030 Agenda for suitable development and its goals, as well as the UHC action agenda. India, through its G20 presidency, has built a consensus to build more resilient, equitable, sustainable, and inclusive health systems equipped to address ongoing global health challenges and future public health emergencies with equitable access to safe, effective, quality assured, and affordable vaccines, therapeutics, diagnostics, and other medical countermeasures. India's COVID leverage technology ensured a systematic and transparent approach to COVID-19 vaccination, helping India manage one of the world's largest vaccination campaigns. E-Sanjeevani telemedicine platform developed by India amplified the reach of healthcare professionals and bridged the urban-rural divide by rendering 10 million consultations. India is one of the strong opinion that investments and democratization of digital public goods facilitated by expert knowledge can reap multiple benefits. Aligning with the same, India would like to offer digital platforms like CoWIN, E-Sanjeevani, and other health platforms like Saksham, that is stimulating advanced knowledge for sustainable.
All right. Minister, I believe we have potentially lost you, but ma'am, we'll try and come to you when the connection possibly reestablishes itself, perhaps at a later time. But to wrap up the session and just to give us the intake of
by
Brazil,
India, to support
Minister,
the integrated.
Minister, can you hear me?
Yeah.
Okay,
Just
Minister, I was just saying that we are just going to get the input from our colleagues in Brazil. Just for a moment in time, I'm going to jump in, ma'am, and we do hope that there will be further time to hear a little bit more from what you have to say. But for now, if we can just allow the colleague from Brazil, Mr. De Freitas, to give us the Brazilian perspective on this conversation. So it's over to you.
Complete just 1 second. Moderator, just let me complete just 1 second. I'm at the end.
Okay, ma'am.
Thank you, moderator. And I just want to thank you, moderator. And we'll believe that by promoting cross collaboration and investing the digital healthcare infrastructure and technology, BRICS can contribute to the development and implementation of digital health technologies, including telemedicine, digital health records, and health information systems. By unlocking the synergies in disease surveillance and early warning systems, we can build a resilient healthcare infrastructure that is better prepared for any future healthcare emergency. Thank you so much. Thank you.
Thank you, ma'am. And Mr. De Freitas, so it's over to you.
Oh, thank you, Mrs. Chair. Well, I would like to introduce here another point of view, especially related to surveillance. First, I would like to thank to the government of South Africa for hosting this event. Ensuring a space for a PPPR discussion at this BRICS meeting is a phenomenal opportunity for us. As you know, the previous federal government that was in power in Brazil until last year was not the best example for acting to protect our people during the COVID-19 pandemic. The previous government denied the sciences, ignored the epidemiologists and the technical staff of Ministry of Health, and decided to take actions that result in the death of thousands of Brazilians. Fortunately, this time is over, and the President Lula and Minister Nisia, together with all health workers, are united for the necessary reconstruction of our unified health system. And therefore, one line of actions that we have to prepare for to fight against to prepare for is the fight against the fake news. That's one thing I would like to stress here, because fake news was an important enemy that we have to fight during the pandemic. A second line of action is preparing for early detection of events to anticipate the next pandemic. In this sense, strengthening traditional surveillance systems is an excellent strategy. I'd like to quickly speak here about two networks that Brazil organized and are being strengthened, and one initiative to improve the early detection of public health. Brazil has 27 federated states and more than 5,000 municipalities. And we have in these municipalities, these municipalities compound a network that in this routine are prepared for surveillance, monitoring, alert, and response to potential public health emergency. In the field of early detection warning, the public health emergency, the Ministry of Health coordinates two networks. The networks for named the network for centers for strategic information in health surveillance. We have 199 centers spread off all the country, including municipalities that is located in the border, and we have many countries that are our neighbor, and these municipalities and these centers are located in cities that is strategic. They are located in municipalities that is strategic for us to share information with our neighbors. And also the National Network for Hospital Epidemiological Surveillance. We have 817 hospitals that are prepared to active search of events that can be important to detect events of emergence.
All right.
And the last thing I would like to say is Brazil is preparing to build a center for epidemiological intelligence. The use of epidemiological intelligence and statistical techniques combined with technology in order to anticipate the detection of public health events that are potential public health emergency is essential. The sooner we detect it, the sooner the response will be, and then we save lives. The epidemiological intelligence for early detection of public health emergency is the future of early detection, and we can combine climate and weather, primary healthcare information. We need to cross this information to create a scenery that can anticipate the pandemics, the future pandemics. Thank you.
Okay. Thank you, Mr. De Freitas. And it is on that note that we're going to close this particular section. Ma'am, could I kindly ask that you keep it brief?
Very brief, sorry. Just one quick point on the manufacturing, and particularly as it relates to the BRICS AU collaboration, with the support of particularly regional platform, the Africa CDC, and engagement of private sector. I think a key investment area would be to support the ecosystem in terms of the regulatory capacity, both the national regulatory and the regional harmonization through AMA, as well as the health workforce, but also really ensuring a reliable market once the strategic investments are done for the vaccine and pharmaceutical manufacturing through this collaboration with BRICS and AU. Thank you very much.
Okay, thank you. And on that note, we will close this particular session. I do know that a lot of the conversations that we are having right now at this particular juncture are conversations that will certainly be extended later on this year. His Excellency did make reference of the Conference on Public Health in Africa, His Excellency Kaseya, and I do believe that what has been shared in this room so far will be built on further later on. With that said, I'd just like to ask the audience once again to help me thank the panelists for their contribution with a warm applause. Thank you, ma'am. And we're now moving on to the session of expert reflections. There's a number of speakers, once again, that will be giving us their input and addressing some key questions that have been put to them that they have prepared for. I would also just like to ask the speakers once again to make sure that they keep and they stick within their allotted time space. In fact, if the question can be answered in around 3 minutes or so, we would greatly appreciate that. But first and foremost, I would like to welcome Dr. Amit Takar, Executive Chairman for the Africa Health Business. Thank you, sir.
Just make sure I don't take too much time. I'll try and handle 1 minute to the rest of the speakers. I want to thank the Minister, Jofala, our host, for giving us this opportunity and getting this wonderful team here in South Africa together to discuss this topic. I have had great time organizing this together with the Business Council, BRICS Business Council, the team involved in that, Africa CDC, Africa Union. Your Excellency, your team has been brilliant in coming together. So we've really are happy. And I've seen so many colleagues from different industry, private sector. I've seen people from the industry. I've seen people from government. And it's a great. Let me take a few minutes just to reflect on where I see the partnership and private sector playing a role. The first thing I want to talk about, we all believe that Africa is in acceleration mode. We are definitely in acceleration mode. And if you don't believe me, let me share with you 3 milestones that might make you believe this acceleration. By 2030, Unstoppable Africa outlined $259 billion, according to UNECA, will be the opportunity in digital and health and wellness sector in Africa. 14% of the new opportunity will be in Africa, just being second to US, which will be standing at 21%. By 2040, 10 years later, you will have heard His Excellency Dr. Kaseya mention 60% of the vaccines to be manufactured on the continent. Then 10 years later, in 2050, we will have 25% of our population in the world being from Africa. So Africa is definitely in acceleration mode. We know that the Unstoppable Africa talked about the various partnerships, and it also spelled that collaboration is the new innovation. And this collaboration is going to thrust us in the partnership that we're looking for with BRICS and the widened BRICS team. I want to mention just 3 points. And I want to talk about where I see the whole model of BRICS taking us in helping us with the 3PR. First is UHC. If you look at universal health coverage and you look at the 5 countries, Brazil, Russia, India, China, South Africa, in the last 20 years, from 2000 to 2020, every country in the BRICS nation has moved up 20 to 30% coverage of their countries. Currently, Russia spends about $774 per person. Brazil is spending about $701, and it's increased phenomenally from the year 2000 by over 60%. And India, which was at 30% coverage, is now almost at 63% UHC coverage. We're still below what Europeans spend at about $4,000 and United States, which spends about $10,000. But the growth is very encouraging. My second point I want to talk about is manufacturing and inputs towards helping health system strengthening in Africa. Investments and capacity building will definitely help us strengthen and shield against future pandemics and future threats. Among the BRIC nations, China and India are providing an immense amount of resource for us. I think those two countries, the way we trade, what supplies, we heard about APIs, we heard about the fact that these 500 manufacturers on the continent still rely on raw materials coming from there. But I think what Russia and Brazil can do, together with championing the process from South Africa, can actually help African nations become stronger and a more effective shield against health threats. Digital health has been spoken about a lot this morning. If you look at the way we started using mobile money and how we connected the unconnected, Africa led this space for the world. Don't you think we can position ourselves to lead again the globe with digital health appliances and solutions that will reach the unreached population? And through partnerships with the BRICS nations and the widened BRICS nation, I think we are really well positioned. I do want to talk about my third point is about, I want to touch a little bit about the market and how we can widen the market. And I want to implore to the BRICS nations through South Africa that having a structure like the BRICS Health Forum, or Madam Olive mentioned about this new framework. We will be talking about governance, we'll be talking about financing, we'll also talk about investments. I want to implore to the BRICS nation that through the African Continental Free Trade Agreement, the amount of market that will be opening up for Africa is immense. Take the first lead. I do believe that using that and using Africa Medicines agencies will have a common market where 1.3 billion people will be ready to look at receiving products that are affordable, of quality, and will be a significant market. So widening the BRICS umbrella with the new countries that we've heard, 2 from Africa, Ethiopia and Egypt. Let's give them a round of applause. And I think you're setting the stage for the rest of the 50 odd countries or the 48 odd countries as they join in. I think Africa will tend to benefit from this widened umbrella of BRICS to strengthen our health systems. And obviously, Your Excellency, the PPPR fund that you mentioned will be the bedrock in creating an interesting public-private partnership. You have our commitment from the private sector that are here, that we will work with you to ensure that we have a stronger health system and we have a solid shield to make sure we manage the future threats. Thank you so much.
Thank you so much, Dr. Amit. And can I also ask Mr. Rajendra Suri, who is the CEO of the Developing Countries Vaccine Manufacturing Network, to join Dr. Amit on stage. Thank you. And to the next speakers. So I think what you showed us is that you have been taking copious notes throughout the session. And what I would just implore on the next speakers is to not steal the thunder of our speakers who will be delivering the closing remarks. But as I did say, there'll be plenty of time to negotiate a bit further. Our next speaker, however, who will be sharing his brief remarks, but specifically answering the question as to the role that civil society can play in the AU BRICS coordination framework, I would like to welcome on stage Mr. Agri Aluso, who is the Director for Africa Region for the Pandemic Action Network, to answer this question as briefly as is possible. Thank you, sir.
Thank you very much, distinguished colleagues, all protocols observed. I stand here on behalf of civil society organizations. It's a privilege to speak to you, and coming after very powerful speeches, I'm humbled that I have this space to just voice what our civil society colleagues, aspire for in this space. There's no need to emphasize that we know what the toll that the COVID pandemic has visited upon humanity, and it's in all dimensions of life: economic, human, educational, developmental, all. And you may have heard that SDGs indicators have stalled, like progress reports have indicated that a number of indicators, stagnated because of the pandemic. So that's how bad it is. And for us, as civil society organization, looking at the pandemic now in its 4th year, even though it has the active emergency phase has been declared over, we cannot fail to reflect on how the world failed itself by not acting in solidarity. And for us in civil society organizations, we're here to remind the world that we need to really recognize that pandemics are not just a matter of health. They transcend health, they transcend borders, they transcend age groups and different populations and different economies. It doesn't matter how rich you are, how poor you are. It's a collective challenge that we must all act collectively to address. And as an African, a philosophy that we always remind ourselves, points, the Ubuntu spirit failed when it mattered the most. And there's a saying in the region where I come from, that one finger cannot kill a lice. And as we know, a lice is a very embarrassing insect to have in your body. It's a show of failure of hygiene. Pandemics are a show of a failure of systems. By the time we have a pandemic, it means we didn't stop outbreaks where they were supposed to have, been stopped. And this happens because of the selfish nature of human beings, where we have tools and resources, but we choose selectively where to deploy them. It matters where you come from. Pandemics are things that signify political failure. And as civil society organization, we are telling the world that outbreaks are inevitable, but pandemics are a political choice. We choose to do the right thing, or we choose not to do the right thing. And for our role as citizens who get impacted on, we have to remind you that humanity deserves better. We need to put people before profit. We need to make our decisions with humanity at the center, not profit at the center. And we need to act collectively, quickly, when our failures have occurred, and not look for opportunities to make profit. And therefore, the organization that I represent, Pandemic Action Network, which now I'm talking about last, represent about 350 organizations globally. And we've had the privilege of working with many bodies, including the UN. I'm happy to have seen my dear sister, Olive here. I've seen my dear sister, who is co-chairing the INB process, Dr. Precious Masoso. And we are happy that the political class is listening. I will be having several conversations on the sidelines of the United General Assembly on high-level meeting on pandemic preparedness and response. And we really want to congratulate His Excellency Dr. Kaseya for really providing leadership, and the Africa Union in general for providing leadership. And we as civil society organizations, we commit to work with you, and we will be your accountability partner in this process. Count on us to do that.
Thank you, sir, for those powerful words. And to speak on the support for developing countries in achieving a sustainable vaccine and countermeasure capabilities. Now, if I could just welcome Mr. Rajendra Suri, who is the CEO for the developing countries at the Vaccine Manufacturing Network. Thank you, sir.
Thank you very much, moderator. Excellencies, dignitaries, distinguished delegates, brothers and sisters. In fact, I sincerely would like to thank Government of South Africa, African Union, Africa CDC, and BRICS Business Council, particularly my brother Stavros, who invited me here, and I am honored to be with you. It was very heartwarming day before yesterday to witness the solidarity expressed by the state heads of BRICS during their address to the BRICS Business Forum, with a strong determination to ensure an exponential growth and focus on collaboration in innovation, infrastructure, financial mechanisms, and human resources. in all important sectors like green energy, machinery, automobiles, agriculture, and pharmaceuticals. Today, while we are deliberating on PPPR, I think it is very important for us to keep in mind the devastating impact of COVID-19. As on 16th August, 770 million cases of COVID were reported, with 6.9 million deaths reported, which could be actually much more. And as per IMF estimates, there was $13.8 trillion economic output loss, which is estimated till end of 2024. With all these things in the background, I think all of us, we need to pay attention to all the three pillars of pandemic prevention, preparedness, and response. That is vaccines, therapeutics, including the medical oxygen, as well as diagnostics, which are critical and need a holistic approach, including but not limited to predictive models, expeditious identification and characterization of strains, R&D and manufacturing timelines to be shrunken, tech transfers and free flow of goods and people, which are important along with the early risk funding. With several North-South and South-South collaborations in place, having developed, manufactured, and supplied around 8 billion doses of COVID-19 vaccines by the developing country vaccine manufacturers, out of which more than 90% came from BRICS countries. I must tell you, this was 60% of the total global COVID-19 vaccine production. And our focus continues to be to promote R&D and diversification of manufacturing networks, strengthen the resilience and transparency in global supply chains and delivery capacities. By pursuing the agenda of sustainable regional vaccine manufacturing strategies and initiatives, which will be taken in a comprehensive manner during the upcoming annual general meeting of DCVMN next month in Cape Town. For building workforce capability, DCVMN is in active collaboration with African Union, is going to organize an online, offline, or on-site blended tech transfer training program, which is scheduled to be held in November. And I am pleased to share with you that we have received more than 500 applications for this particular initiative. And this is for Africa, by Africa. Thank you. To ensure equitable, inclusive, accountable, and timely access to safe, effective, and quality, affordable medical countermeasures, MCM, during the health emergencies, we encourage strong collaboration between governments, international organizations, regulators, and private sector, including, of course, research institutions and multilateral development banks, to ensure and promote R&D and diversify the manufacturing networks. We are confident that developing country vaccine manufacturers will continue to play a very, very strategic and vital role as the natural allies, right from innovation, R&D, faster development, large-scale manufacturing, and timely delivery. Finally, to summarize, I would insist that we need to have and develop sustainable regional capacity for Africa, by Africa, as we cannot depend on neighbors or other countries. We need to have a clear mapping of end-to-end real needs, as also the available resources to effectively do the matchmaking and ensure a sustainable, reliable revenue streams and reasonable profitability for all concerned. Thank you very much.
Thank you. Thank you. Thank you so much, sir. And now to hear from Dr. Merawi Aragal, who is the head of the emergency preparedness at the Africa Center for Disease and Disease Control and Prevention. He is joining us online, so just to confirm that you are there. Okay, let's move on for a short while, and we move on to Mr. Igor de Silva Barbosa, the diplomat to the Ministry of External Relations at the Federal District of Brazil. Mr. Igor, are you there, sir?
Yes. Hello. Do you hear me, moderator?
Yes, sir,
Very
loud
good
and
morning.
clear. Good morning, sir. We
Thank
look
you.
forward to your brief reflection.
Thank you so much, and good morning to all colleagues here in this BRICS environment, a very important environment for us in Brazil. I did not prepare specific intervention because I thought that I would be reflecting upon other people's inputs, and I hope that this is also helpful. The first point that I would like to make is a specific mention about one initial speech that mentioned NCDs as an important next pandemic that we have to address. And this is an important issue for us in Brazil. We have been constantly saying that we must not forget existing health problems while we try to address this future pandemics. Of course, both are important, but the world in general and BRICS countries in particular have very specific health challenges that are present. And I would mention, for instance, tuberculosis as one important topic that we have been cooperating for a long time now. And this is very interesting. I would also refer to the intervention that was made by my colleague from Russia, where he mentioned important technological advancements in his country that could, of course, be shared and collaborated upon by other BRICS countries. And I think this is an important thing for us as big developing countries, as major developing countries, to have clarity on the importance to have these technological capacities. Brazil has been advocating very fervently in benefit of having specific local production arrangements. The pandemic has shown that we cannot rely on a concentrated system of production of medical countermeasures, and this is an important topic. We have to strive as BRICS countries to have more clarity on pushing forward this agenda for the diversification of production sites in the world to have medical countermeasures. And then this has to do, of course, and I believe I'll be finishing my statement with this specific message to try to respect also the time allocated to me. Is about, I will try to react a little bit on Dr. Shishana and Ambassador John Arndt's remarks on the interim platform. We, of course, have a priority to discuss a permanent solution naturally through the processes in the intergovernmental negotiating body and also the WGIHR. We see potential merit in having an interim arrangement to make the world safer and try to address some specific challenges that we faced, as Dr. Shishana very well put, during the ACT Accelerator experience, specifically the lack of participation of low and middle income countries, and then also the participation of regional organizations and this end-to-end perspective for us to control from the research and development until the delivery in the last mile. This is an important matter. I would just like to recall and flag the G20 declaration that was just adopted last week in India, where it calls for a consultative WHO convened process to discuss this platform. We are still very, very we as Brazil, we still have doubts as to how this platform would operate. We would like to provide our own inputs, and I think that the BRICS countries are very much to be concerned and to participate in this process that we envisage in the build-up and negotiation of exactly how this platform is going to look like, because so far it's not clear to us, and I believe to other colleagues as well, as to how this is going to play out. And this is a commitment from the DG himself, Dr. Tedros, in his speech in India. He said that he wants to include other countries in this process that should be inclusive. I thank you so much, and I appreciate the opportunity of being here. Thank you.
Okay. Thank you. We move on now. Our next speaker, Ms. Priya Basu, the Executive Head of the Secretariat Pandemic Fund at the World Bank, will address how the World Bank will, and the World Bank Fund specifically, will ensure that it disperses funding more equitably to the South and ensure that regional bodies like the Africa CDC are recognized as implementing agents. Ma'am, it's over to you.
Thank you so much. Honorable Ministers, Your Excellencies, distinguished participants, I'd like to thank the BRICS Business Council, the African Union, the African CDC, and the Africa Health Business for inviting me to this meeting. I'm here representing the Pandemic Fund, which is a multi-stakeholder partnership housed at the World Bank and operated in very close collaboration with the World Health Organization. I want to start by commending you for organizing this event, because we must maintain the focus on helping countries and the world build resilience to global health threats. And there's a real urgency, as the next pandemic won't wait for us. COVID-19 has demonstrated how a microscopic pathogen can spread across the globe, leading to death, disrupting communities and economies, destabilizing national security, and undoing decades of progress. While important lessons have been learned, and many of them have come out in today's deliberations, the reality is that we're still not ready for the next pandemic. There are massive gaps in pandemic prevention, preparedness, and response capacities across developing countries, especially in the poorest and most fragile settings. So we cannot sit idle, and we must be prepared, because lives, livelihoods, and global economic stability are all at stake. So what does this show us, and what does it take to be better prepared? And many of these points have been highlighted, but I just want to emphasize that we need stronger health systems, especially at the primary and community level. We need better surveillance, laboratories, and data reporting systems that are interoperable and properly networked. We need better emergency management capacity. We need a health workforce and infrastructure that can respond quickly and effectively to disease outbreaks while ensuring continuity of essential health services. We need equitable, affordable, and timely access to medical countermeasures and essential supplies in times of crisis. And we need strong and determined leadership that listens to science, and we need effective collaboration across borders. So, of course, building pandemic resilience does require long-term investments, but the resources needed are a fraction of the costs of being unprepared. Last year, against this backdrop, the international community came together to establish at record speed the Pandemic Fund, housed at the World Bank and operated in close collaboration with the WHO. It's the first multilateral financing mechanism dedicated to strengthening pandemic PPPR capacities in low and middle income countries. In a context where international financing for pandemics remains fragmented, siloed, and ad hoc, the Pandemic Fund provides long-term, predictable funding that is coordinated across organizations with similar goals. And we can invest to strengthen much-needed regional and global capacity on top of country capacity. Our grant financing offers a real opportunity to do things differently, and we're already beginning to see this through the projects we're supporting under our first round. Turning to some of the specific questions, firstly on governance. The governance of the Pandemic Fund is very inclusive. It benefits from the voices of both Global South and Global North equally, and expertise in both health and finance. Of the 21 constituency-based voting seats on the board, 9 are for contributors, 9 for what we call co-investors, the developing world, 1 for private foundations, and 2 for civil society. I want to note that BRICS are well represented on our board. China, India, and South Africa are all contributors, and they are on our board along with Indonesia and other developing countries. Of the 9 voting constituencies for co-investors, 4 constituencies are chaired by African Union member states: DRC, Rwanda, Senegal, and Egypt. Latin America is currently represented by Guyana. Africa CDC is also a part of our board. This means that BRICS and AU member states have a strong voice on our board and the ability to shape decisions. The Pandemic Funds Board is chaired by the Health Minister of Rwanda, Dr. Nzanzimana, and the former Finance Minister of Indonesia, Dr. Basri. Second, on the question of access to pandemic fund grants. Our grants are for low and middle income countries. Our board awarded funding to projects under the first round just last month on July 19th, keeping a strong focus on geographical balance and priority to low income and lower middle income countries. The awarded grants totaling $338 million will mobilize over $2 billion to help 37 countries strengthen their capacity to prevent, prepare for, and respond to pandemics. All geographic regions are covered by the 19 projects selected for funding. 75% of these projects are in low and lower middle income countries. Sub-Saharan Africa has received the largest share of grant allocations among all regions. 32% of grants have been allocated for projects in Sub-Saharan Africa, from where we saw the highest demand. And these are innovative and ambitious projects in Burkina Faso, Cabo Verde, Ethiopia, Togo, and Zambia. Almost all projects take a One Health approach and include AMR surveillance. And several of the projects include cross-country collaboration in regional capacity building for bodies like CARPHA, the Caribbean Public Health Agency, for example, which submitted a proposal for funding. This first round was a learning round. The demand was huge. 133 eligible countries applied, and we recognize that the outcome has left many countries disappointed. To maintain the momentum, our board is aiming to launch the second call by the end of 2023, and we will draw on lessons learned. And lastly, on the question of implementing entities, since this has been brought up. So currently, we have 13 implementing entities, but the board has just approved a framework that will allow us to include additional implementing entities, including regional bodies who are interested in playing this role. Just to clarify though, implementing entities simply channel and oversee funds and support implementation. Fulfilling the promise of the Pandemic Fund to help countries and the world become more resilient to future health threats will require more resources beyond the $2 billion in seed capital that we've raised so far, and we're working on that. Okay. Equally, effective partnerships for delivery are vital. So we look forward to working with all of you as we embark on the second year of the Pandemic Fund's work. Thank you for your attention.
Thank you. And thank you, Ms. Priya, for addressing all the questions. Last but not least, Dr. Douglas Noble, the Associate Director for Public Health Emergencies, Preparedness and Response. Joining us online also from UNICEF, who will speak to UNICEF's role in PPPR.
Yeah, well, thank you. Thank you, Chair. Thanks for the opportunity to be here. I think I'm one of the last speakers, as you said, but perhaps I can just use that opportunity to assure you that UNICEF stands with all of you in partnership to reach the last mile. That's really the goal of our organization, and we welcome the opportunity to do that together through our existing partnerships that we have with many of you, and as we seek to consider the best interests of children, women, and communities. Let me start by saying that pandemic prevention, preparedness, and response needs a whole of government, whole of society approach that should involve ministries of social welfare, education, water and sanitation, and others, in addition to ministries of health. We must consider the wider determinants of health in pandemics and to keep communities at the heart of the response, with a focus on vulnerable groups, children, those in fragile and emergency contexts. Paid, equipped, and trained frontline health workers are a key part of our efforts, including the 70% of frontline health workers who are women, and are critical for community surveillance, providing care, and engaging with communities. We've heard a lot today about medical countermeasures, and effective global preparedness and response relies on equitable and timely access to medical countermeasures. And we're delighted to be working with the African Union, Africa CDC, Africa Medicine Agency, Africa Union Development Agency, NEPAD, to advance the localization of vaccines, diagnostics, and therapeutic manufacturing. A geographically diverse manufacturing base will assist us in supporting a rapid, equitable, and sustainable response to the next pandemic. It also entails technology transfer that was also mentioned earlier today. And the time to make progress in technology transfer is now, during the inter-pandemic period, when we've got the time to build capacity. In 2022, UNICEF's overall procurement totaled $7.38 billion US, elevated somewhat to the COVID-19 response. And so working with the World Health Organization and other partners, the private sector, UNICEF's an integral partner and really does stand with you to ensure access to medical countermeasures from start to last mile delivery. We need to continue to learn from those gaps that we identified during the COVID-19 pandemic and build on current networks, knowledge, and practices. And we need to be fast about doing it. We also need strong community engagement to reduce hesitancy and increase trust to ensure the uptake of medical countermeasures during an emergency. Well, let me stop there as I know time's short. And thank you again for the opportunity to be here today. And we very much look forward to working with you to harness the current momentum moving forward. Thank you.
Thanks, Douglas. You stopped even at an opportune time where someone's timer actually went off. And I think that was the best signal, just to signify that the program does certainly need to wrap up. I'd like to also thank the various speakers for their contribution and also invite you to rejoin the audience. Thank you. So last but not least, we are at the last mile right now. Essentially, we've entered into the closing remarks and the way forward. And I'd like to invite once again His Excellency Dr. John Kaseya for the Africa CDC to come back on stage, as well as Mr. Martin Kingston, Chairperson of B4SA, to come on stage with him. That's collaboration in action, right? And Your Excellency, so you're first up, but if you could just lead the session in providing the closing remarks, sir. Thank you.
Thank you, colleagues. Let me start by the statement made by my brother Agri from the network of civil society organizations. He said, collaboration is the new innovation. I think all of us, we agree today that PPPR, we need to be together. Private sector, civil society organizations, our communities, public sector, and to push this agenda. And we also agree, and let me quote also, no, it was Amit who said that, sorry, Amit, I'm sorry, but what Agri said was, pandemic is a political agenda. We need to choose to do good things or not. And let me tell you, colleagues, other continents are being ready for the PPPR. General Friedrich was appointed by President Biden to lead the PPPR at the White House level. It was the 21st of July. We know my brother, Dr. Kengasong, is doing the same at the Secretary of State level. What are we doing in Africa? How are we preparing the next pandemic? We discussed today about local manufacturing and tech transfer, and also the platform for MCM. My sister, Professor Olive, and John, they provided some comment on that. Heard also from Brazil that we need more inclusion, more countries buying the process. We also had the opportunity to discuss about how community health workers can build the system, and Dr. Leah provided some remarkable example of Ethiopia for the primary health care. And let me share with you that she's organizing the International Conference on Primary Health Care in Addis Ababa from the 5th to the 7th of September. And she told me to invite all of you. I think some of you will attend this important meeting. because we believe that primary health care is the foundation for the PPPR. We had the opportunity to listen and to agree with my friend Priya from the Pandemic Fund, talking about this important vehicle that we have and opportunity to leverage resources for the Pandemic Fund. And I think Priya also understood that as AU and BRICS, we are putting in place this BRICS PPPR fund that can complement what we can receive from the Pandemic Fund. What I said to Priya, I want to disclose it to all of you. Africa was the only continent for the first round we didn't submit a regional proposal. We sent individual proposals from countries. Why we need to do that? While we know that other regions, like Caribbean regions, like East Asia, Central Asia, they came with regional proposals. I was discussing with my brother, Minister Pala, saying for the next round, Africa CDC will make sure that Africa will not submit regional proposals. That regional proposal will help all of us to come together and to see what can be the added value that we can bring to our systems. We agree also with colleagues who shared with us some important information about how to strengthen the system using some opportunities that we have. And Amit talked about the digital agenda. The digital agenda, the digital transformation is the key one in Africa. It's our key priority. You can imagine, I have to share to colleagues that we had a Marburg outbreak in Tanzania. We had a Marburg outbreak in Equatorial Guinea. There is a linkage, but there is no direct flight between Zambia and Equatorial Guinea. How this outbreak moved from one country to another one without contaminating other countries. It means we need a system that is so sensitive, using the digital platform to share information on timely mode and to guide our decision-making process. We want also to say that as Africa CDC, we are supporting the agenda of bringing all partners together. And I was so happy to see my sister, Dr. Mweti. I will meet her in a few days in Botswana. We are working closely. We launched what we call the Joint Emergency Action Plan to support the pandemic preparedness response in Africa. Together, WHO, Africa CDC, we are working with UNICEF and other colleagues to support this agenda. I think with these few words, we can say that we are all committed now to become well prepared for the next pandemic. When others are prepared, let us be prepared, because if we are not prepared, the world will never be safe. Thank you very much.
Well, thank you very much indeed. You've stolen all of my summary points. I just want to make a couple before I give a vote of thanks, if I may. The first is that from my perspective, the only thing that works is an integrated response. Leveraging resources, learnings, and capabilities wherever they exist. That's exactly the point that has just been made. And that's a public sector, bilateral and multilateral, civil society, and business response working together hand in glove. And of course, that was our experience here in South Africa, where we had an all-of-society response led by the Department of Health and the Minister of Health, who's here currently with his team, where we brought in all of business, whether it was through organized business structures or independently. And I think that the result of that, probably unparalleled elsewhere in the world, we've discussed it, made sure that we had a successful response, although we could have mobilized earlier. And of course, we're repeating that again now in South Africa and addressing many of the challenges that we have by making sure that business works hand in hand in support of and alongside government in many of the issues that are confronting the country. And again, harnessing resources wherever necessary, including of course, civil society and other structures. If I can also say that one of the learnings from this, of course, has been identifying the obstacles that we all encountered during COVID-19 and making sure, as was said earlier on, that we don't repeat the same mistakes. It's extraordinary how we consistently repeat mistakes and we don't learn moving forwards. We need to do that to mobilize our resources, and therefore the interim structures that we were talking about, the Johannesburg process, and indeed I would say harnessing the enlarged BRICS, as well as utilizing the resources of the NDB, as indeed Professor Shisana, you said, is absolutely essential. That's what they're there for. And perhaps the last point that I would make in this regard is, please can we ensure we don't duplicate work? Was that a hint? Please make sure we don't duplicate work that is being done. Rather, let's make sure that effective collaboration is the key to success. Fifi, you said at the beginning, let's make sure that no one is left behind. In fact, the way I'd put it is, we're all in this together. I don't know whether any of you have read The Three Musketeers by Alexandre Dumas, but there, what they say is one for all and all for one. That's the only way that we can respond effectively to these pandemics. If I can thank all of the speakers, Minister Pachler from South Africa, Dr. Jean Kaseya from Africa CDC, Dr. Tardesse, Minister Tardesse from Ethiopia, Dr. Kandil from Egypt, Mr. David Roberto de Freitas from Brazil, Dr. Pawar from India, and Dr. Oleg Salagay from Russia. If I can thank Professor Shisana from the South African Presidency and John Rottinger from Norway, and indeed our many various institutional agency partner organizations, Dr. Moeti, who's from the World Health Organization, Dr. Bekele Thomas from NEPAD, Professor Michael Sidibe, the envoy for the AMA, Mr. Ibrahima Cheikh Diong from the United Nations. It's a phenomenal cast list, I have to say, we've pulled together here. Mr. Agre Aluso from Pandemic Action Network, Mr. Suvi from DVMNC, Dr. Aragao from Africa CDC, Mr. Da Silva Barbosa from Brazil, Ms. Priya Basu, we just heard from, of course, from the World Bank, and Mr. Douglas Noble from UNICEF. Also, Mr. Dr. Amit Thacker from AHB, and although he's not here, I think the person who actually did pull it all together, of course, Mr. Stavros Nicolaou from the BRICS Business Council. I've never seen anybody work so hard and so tenaciously to pull something like this together. Of course, assisted by the organizing committee, Dr. Nikes Ndebi from Africa CDC, Dr. Lwazi Manzi, the AU COVID Secretariat, Dr. Alama from AHB, Dr. Lisa Bonadonna from Aspen Pharmacare, and then the team that really does pull it together, Althea Noble, Sanele Koza, Zikona Captain, and Charmaine Venkatsamy of the BRICS Business Council, and Yavi Madura of the African Continental Free Trade Association. Dr. Marawi Aragao, I've already mentioned, from Africa CDC, who sat on the organizing committee, and Dr. Zamban Pillay and Percy McClarty from the Department of Health. But actually, I want to save the best until last. If there's one job I wouldn't want, it's to be Fifi Peters. I think she's done a phenomenal job as our moderator. You really have, Fifi, against the clock. There's nothing, I think, worse than being the chair of a meeting when the clock starts ticking. And you know as soon as the clock's ticking that you're going to run out of time before you've even started, let alone finished. So thank you very much for keeping us both to time and keeping your cool throughout. And then our sponsor, Aspen Pharmacare, again, for having provided all of the support necessary. Fifi, I think it's back and over to you.
And as Martin has said, the time has ticked way past it's o'clock, so no further words from me. But to just ask all the speakers who did address us today, could you kindly, before you make your way out towards the networking, come back on stage for a photo opportunity? Would like to snap that you were here. And thanks once again, and it's goodbye.